Summer is already proving to be a very bad one for ticks.
Doctors are seeing an increase in tick-borne illnesses like Lyme disease, and Wisconsin has one of the highest number of the cases in the country.
Yep, the illness often goes undetected or misdiagnosed. UW Health's Dr. Jeff Potoff is here for his weekly visit. Hi, Dr. Potoff.
Hey, how are you guys?
This is one of the less fun stories of the summer,
for sure.
But it's important. What is Lyme disease?
So Lyme disease is a bacterial infection. Humans, we contract it from ticks, but specifically the deer tick. Other ticks do not transmit it. And symptoms that you get, most everyone will feel fatigue. They'll have muscle aches and pains. Joints might hurt, and oftentimes affiliated with a headache. So it can mimic a lot of other things. So the trick with Lyme disease, it's not hard to treat. It's just sometimes hard to know if you have it or not.
We were speaking a little bit off camera about how you can contract it. What is the timeline and how long does it take for somebody to actually get Lyme disease?
Yeah, so this is good information to know. What a lot of people don't know is that if a tick latches onto you, so it's actually attached to your skin, it takes at least 24 hours for it to transmit Lyme to you, sometimes up to 48 hours. So if you are, say, camping or you're out kind of walking in the tall grass, you're thinking, hey, I might have a tick, and you look and you're like, oh my goodness, I do, and you get it off before 24 hours, you're good to go. You don't get Lyme disease. It's when you don't recognize that you have the tick on you and the tick stays on there for days and then eventually drops off when you put yourself at risk of getting Lyme disease.
How do you treat it?
Yeah, so it's actually pretty simple. Doxycycline, a very simple, cheap antibiotic, is how you treat it. You're on that for a good number of days, but not hard to treat, not expensive to treat. It's just knowing that you got to be treated.
And so we just went over how you treat it in the event that you think that you do. Where exactly do you go? Do you have to go to a local like emergency room? Where do you go exactly?
If you think you've been bitten.
Yeah. So let's say like you've been bitten or you've been bitten and you have this classic rash. There's this like target rash that you get. You'd probably call your primary care doctor. They would either talk to you maybe on a virtual visit, maybe have you come in. There's a blood test that we can do to see if you have Lyme disease, and then they would prescribe doxycycline. Lots of times you don't require emergency department treatment or things like that. Not that we don't pull a fair number of ticks off of people that come see us, but for the most part, if you're having symptoms, you call your primary care doctor, say, hey, I think maybe I got something going on here, and they'll take it from there.
But Lyme can be pretty debilitating. I mean, some people develop like chronic symptoms.
Yeah, I think so. Both people who don't realize that they have Lyme disease, they'll be miserable and they'll be trying to figure out, what's going on. At the same time, like that exposure history is probably getting lost in the weeds now because it's been a couple months. Some people do get a chronic Lyme. Now, once you treat it with doxycycline, when we test people's blood, they don't continue to have the bacteria, but we think it maybe sets up a bit of an immune reaction where people can have the most common symptom that persists would be joint pain. They'll have one or two large joints that just seem achy for a really long time, even after they've been treated for Lyme disease.
So you just have to check anytime you're out in nature because they're out with a vengeance right now.
Absolutely, especially in Wisconsin. I think bug repellent, permethrin from your clothes, and then just make sure you're checking yourself, doing tick checks between family members when you're in an environment where you're like, man, I could have really picked up a tick here.
You just pry it off with a tweezers?
You grab it with a tweezers right at the head and you pull straight back. Don't use a lighter, you burn yourself. Don't try like other things, just tweezer at the back of the head, straight pull back. It'll stick just a little bit, it'll pop off and you'll be good.
All right, well, sounds good.
Good.
You bet.
Have a good summer.
You too.
Thanks, Dr. Potoff. We'll see you in 2 weeks. You're off next week,
That's
right?
right.
Okay,
All
have a
right,
good
we'll see you then.
vacation.
See you then.